I'm also here to announce good news. Today, the FDA is filing a Federal Register notice to change the label on an exciting treatment called prescription leucovorin so that it can be available to children with autism. You know, autism may also be due to an autoimmune reaction to a folate receptor on the brain, not allowing that important vitamin to get into the brain cells. It's a fairly established, mature pathway. Again, we have a duty to let doctors and the public know we are going to change the label to make it available. Hundreds of thousands of kids, in my opinion, will benefit. One study found that with kids with autism and chronic folate deficiency, 2/3 of kids with autism symptoms had improvement, and some marked improvement. Mr. President, you told us to do what's medically right, to go bold, and not worry about the corporations and the lobbyists. So that's what we're here doing today. Thank you, Mr. President.
Good. Thank you. Thanks, Marty. I think you all appreciate the passion in the President's voice. We've been hearing that since the inauguration. In fact, even before the inauguration, the President was upset about what he spoke to today. And so together with Secretary Kennedy, who's made it his life's work to address some of these challenges with autism, they challenged us. In fact, they were harsher than that. They wanted no silos to break down what the NIH would do, what the FDA would do, what CMS would do. They insisted that the physician leaders bust through the clutter because their agencies had the power if we didn't do what every other prior administration had done, which is to let people function within their siloed environments. Because of that, in historic fashion and a very accelerated manner, we have a response today to the autism crisis. It is the first of several chapters, but this is breaking news. You've heard some of it. The response to the autism crisis is going to continue to come to you under Secretary Kennedy's leadership, and the President wouldn't have it any other way, as you've heard. The FDA, based on NIH research, is approving prescription leucovorin for treatment of autistic children. Now, if you're following the script, there should be two questions that you have, two questions that should come to your mind. The first is, how will patients and parents get access to the treatment? I'll tell you how. Over half of American children are covered by Medicaid and CHIP, government health insurance, over half. Therefore, because they're covered in Medicaid and CHIP, upon this label change by Marty, state Medicaid programs in partnership with CMS will cover prescription leucovorin around the country. It's yours, but you have to go to a doctor to get a prescription because they know your child, they know you, and they know the medication. States will also have tools to monitor its use and ensure appropriate utilization. That's important for a bunch of reasons, because we want the right kids getting the right prescription medications. We believe private insurance companies will rapidly follow our lead if they have not already done so. And again, to make sure that this is safe and effective treatment, you need a physician to prescribe the medication because it's on prescription. Second big question. How are we going to collect clinical data to answer the big questions that the President is asking and the Secretary insists that we offer? CMS is also issuing guidance to convene states and existing research networks to support NIH and FDA in their research efforts of prescription leucovorin, while also maintaining the privacy of all patients, all health information of our beneficiaries. Collecting real-world data, which is what many of you have been asking us to do in the community, is fast, it is life-saving, and we'll get answers based on what happens over the next few months with this approach. The aggressive approach, and it is aggressive, demanded by the President and by the Secretary, have already identified risk factors and opened the door for the first FDA-recognized treatment pathway for autism. It is the first of its kind, and it wouldn't have happened without the leadership of the President and the Secretary. The five-fold increased prevalence of autism over the past 25 years demands a rapid response. The average clinician, researcher, we spoke to many, thought it would take 5 years to get this data. Parents are unwilling to wait 5 years. The President is unwilling to wait 5 years for these results. So the President and the Secretary are acting today with this tri-agency move. The administration's bold actions investing in groundbreaking research follow the science. They restore trust, which has been lacking, and they will change the trajectory for millions of American families. Mr. President, God bless you for being brave.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.